Hi everyone, I'm Adrian Hernandez, and my Switch project for leadership and professionalism in athletic training, Fall Block 1, is increasing communication to decrease unnecessary medical care in the United States Navy. The lack of communication between the healthcare team has resulted in repetition of exams, unnecessary tests to be conducted, and overtreatment of injuries and illnesses. Although this is seen more with network providers, which are civilian medical care, the lack of communication can also be noted within the military providers. The goal of this project is to establish a protocol of cross-communication between the military healthcare team and network providers. This would further enable all information to be input into the Navy's version of the electronic medical records. By inputting all information into the EMR, the primary care manager will have more insight. This diagram is the process we want to take within the military healthcare providers to avoid repetition. We want the primary care manager to communicate with the military healthcare clinics, and the healthcare clinic communicate directly with the PCM before they are referred to a network provider. This would allow the primary care manager to overlook all referrals. The second diagram shows the flow we want to achieve when a member is referred out to a network provider. A member is sent to a network provider in the case that a military clinic or provider cannot perform specialized diagnostics for the member. The primary care manager has a final input in what tests are ordered. The primary care manager is the writer, and the destination is to end the fiscal year under the allotted military healthcare budget. The writer needs to communicate better with the elephant, which is the military members and the entire healthcare team. The writer also needs to ensure that information is being put into the EMR to ensure the elephant needs are taken care of. The elephants are the healthcare team. The network providers are constantly trying to order further and unnecessary testing for the fear of malpractice, and the military healthcare team is trying to do what they can with what they have. The military healthcare team is usually overworked and tired. They are at work on a salary basis, so this might also decrease their motivation. The primary care managers will communicate directly with the military healthcare team and the network providers and have the final say over who is further being referred, and the PCM is the final approver on exams and procedures being requested by the network providers. The primary care managers can also delegate to the athletic trainers and use them as a one-stop shop. There will be two measurable outcomes. Members will have all information input into the EMR within a 48-hour period. The second measurable outcome is to have a single test conducted per injury within a 3-month period. These two measurable outcomes will not only decrease repetition, but allow for habits of communication to form between the entire healthcare team. The increase of communication between the healthcare team would allow the athletic trainers within the current military senate to have a standardized communication protocol. This would also allow for the open discussion between the primary care manager, network providers, and athletic trainers. In the near future, if the strategy works out, the athletic trainers can be utilized to the full capacity. As you're looking through my references, I'd like to also take this time to thank everyone for providing such wonderful insight throughout this term.